Now that you know something about survivorship, let's talk about late effects. Late effects are problems related to cancer therapy that occur or persist after treatment has ended. The incidence of late effects increases with age, and these consequences can take a decade or more to be visible. Careful follow-up after treatment has ended allows your medical team to find and treat any late effects as early as possible. Late effects can occur in any part or system of your body. We will discuss late effects in broad domains such as physical, cognitive, emotional, psychosocial, and vocational. Some of the most common late effects in the physical domain include problems with growth and development. Cancer treatments, especially radiation to the head and spine, can cause growth delay. Radiation to the head can also affect the pituitary gland, which is responsible for controlling many of the hormones in your body. Fatigue, constipation, decreased appetite, and low energy can be associated with pituitary dysfunction. Bone health can also be affected by radiation and corticosteroids. Both of these treatments can destroy the blood vessels that feed your bone, causing pain and/or breaks. Cognitive issues can occur in almost any child treated for cancer. However, younger age and the diagnosis of a brain tumor or acute lymphoblastic leukemia are associated with a higher risk for cognitive effects of therapy. Learning problems can be acute or chronic and may occur after treatment has ended. Common issues include short-term memory deficits, difficulty with word retrieval, slower thinking and processing speeds, poor organizational skills, attention problems, including distractibility and poor concentration, difficulty with multitasking, and stamina and fatigue issues. Any child treated for a pediatric malignancy who is experiencing school difficulties should have a neuropsychological evaluation to assess how information is processed and to identify strengths and weaknesses. Most childhood cancer survivors and parents are concerned about fertility issues that may occur and the health of future offspring. While most survivors will have healthy children, some survivors will be at risk for reproductive issues. Some women may experience irregular periods, early menopause, and uterine changes. Young men may experience difficulty with libido and decreased sperm production. Treatments associated with reproductive issues include radiation to the brain, ovaries, testes, and uterus, and certain chemotherapeutic agents. Most studies have not found an increased risk of congenital health problems in children of cancer survivors. Emotional and psychosocial issues can occur following cancer treatment. Children may be worried about their cancer coming back or have concerns about some of the physical limitations or changes that are a result of their treatment. Issues with body image following surgery can occur. Children may worry about being different or finding their new normal. Some children will bounce back into life after cancer, while others may have more difficulty in this transition. Some young adults may lack the motivation to launch or become independent. If psychological distress affects relationships, school, work, or other aspects of life, then it may signal the need for evaluation by a mental health professional. Certain chemotherapeutic agents, or anthracyclines, and radiation to the chest or abdomen can cause heart damage, especially if treatment were at higher doses or given when the heart was still growing. Reduced ventricular function, valve changes, and EKG changes are examples of some of the potential late effects to the heart. Eating a low-fat diet, maintaining appropriate weight, getting regular exercise, and avoidance of tobacco can help keep your heart healthy. Childhood cancer survivors are at risk for second malignancies, although the risk is not the same for every survivor. The type of cancer, the treatment received, the age of the child at diagnosis, and genetic makeup are important factors in determining second malignancy risk. Childhood cancer survivors who receive radiation tend to have a higher risk of secondary cancers in the areas that were radiated. Tobacco use in any form, excessive sun exposure without protection, and heavy alcohol use can increase the risk for secondary cancers, while engaging in healthy lifestyle behaviors can be effective in lowering the risk of second malignancies. I hope I've given you something to think about, and we look forward to seeing you in the Survivorship Clinic.